I don't know if there's a quick silver bullet for mental health. It cascades into so many other areas and cities that cities are dealing with. First and foremost is the homelessness issue. So the housing and the homelessness are one and almost the same. They have to be addressed together. That in turn comes from the mental health issues, which we also need to put more focus in. It's not just throwing these folks in jail, but it's giving them the help they need to get them off the streets. So everything plays into this, and we need to, as a state, as cities, be focused on how do we address that. And what's so unique about Oregon is there are so many programs happening in so many different parts of the state, and so many ways to learn. And there'll be that information sharing at the annual conference. There'll be that opportunity to share best practices and to maybe take something that you've learned here and implement it in your community that crosses all these boundaries to address the mental health crisis.
When you have someone who's experiencing a crisis, they reach out to the people or the places that they're used to, and so usually you're going to have law enforcement who's responding to those situations. So if you don't have the funding that's able to help address those crisis situations, those individuals who are experiencing that crisis in a way that's meaningful to them, that helps them find a solution, then they're going to be rotated right through the system again, and then back on that phone with the potential police officers and law enforcement, and that isn't really the help that they need. So having those resources available locally to help that person in crisis find the things that they need, whatever it is that they're suffering from, making them feel like they have an option, they have some ways they can solve those problems.
Mental health is a challenge in our community because there just simply aren't the resources. Even if you have good insurance, you can wait two months to get an appointment with a therapist if you're feeling suicidal. That's ridiculous. And it's the same, and it's even worse, of course, if you don't have good insurance. They just simply are not. We don't pay our mental health care professionals at levels that encourage them to stay in the business. We have people with master's degrees making less than $15 an hour. Of course, that's just not feasible. And so it's not only underfunded; it's underfunded at every single level.
In the state of Oregon right now, it seems like the primary mental health care providers are the prison system and the street. And that is not in any way a sustainable situation. We've got many people in the state who need mental health care, some very profound issues with mental health. And right now it's almost impossible to get it for them because there's just not the money. And we need state and federal support both to try to reverse that and do something about it, because this is a problem that everybody's seeing. When you look out, you see all the homeless folks. A huge percentage of those people are in fact suffering mental illnesses, and that's a big part of why they're out there. And it's neither economically realistic to just leave them out there, nor is it in any way ethically good or right to just ignore them and let them try to scrape out an existence on the streets. It's not good for anybody.
More clinics. I'd like to see intervention earlier. All these horrible stories we hear around the nation, the mass shootings and things like that. I'm convinced all of that's driven by mental health issues. And the earlier you can intervene and start finding some of those issues and deal with them and get people help, the better off society as a whole is going to be.
Certainly my personal opinion is that the state of Oregon has somewhat dropped the ball with regards to mental health oversight. I know beds that the state used to manage have diminished over the years. I don't know if that's budgetary issues or public outcry, but it's certainly impacting not only our local residents, it's also impacting our public safety from a county perspective.